Hi guys, I'm Dr. Martina Hodgson. I'm a dentist, but I'm also a mum of two very enthusiastic boys, and there is an absolute ton of misinformation and old wives' tales about there to do with your oral health and pregnancy. So today I'm going to bust some myths and we're going to look at 6 truths about how pregnancy can affect your oral health and vice versa. So the first one is the most common thing that we see during pregnancy, and it's that all those hormones flying around can lead to something called pregnancy gingivitis. Now basically it's when your gums become quite inflamed, they bleed really easily, and it will only happen in the presence of plaque. So that's that white buildup that you get on your teeth that's full of bacteria. But your body responds more than it normally would to that bacteria. So the way to make sure that you don't get it is to keep your teeth as clean as you possibly can, brush your teeth twice a day with a fluoride toothpaste, and make sure that you're flossing daily or using those little interdental sticks just to keep the plaque at bay. So the second big one is morning sickness. Now we've all been there, those of us that have had babies, unless you're super lucky. If you're vomiting a lot, obviously that contains a lot of acid and it can make your teeth more prone to enamel erosion. So it's just something to keep an eye on. Make sure if you are sick that you're not brushing your teeth straight afterwards, so you're brushing the acid into your teeth. Rinse around with water and maybe have a snack like something like some cheese, something that's alkaline that's going to kind of counteract that acidic effect on your teeth. It's no secret that when you're pregnant you can often be subject to all sorts of crazy cravings, and if it's sugary things that you're craving all the time, or you're increasing the frequency of your sugar intake through snacks and sugary drinks, then obviously that's going to increase your risk of tooth decay. So really my advice is just to keep an eye on how much sugar that you've actually got in your diet, and again make sure that you're brushing twice a day with a fluoride toothpaste. This one's something you've probably never heard of, but there's these little lumps that can grow on your gum sometimes, and it's called a pregnancy epulis. It just appears on your gum, it's like a little harmless lump, and it appears as a result of irritation or plaque buildup around your teeth. It's just due to all those hormones flying around, and it's completely harmless, although it might be a little bit irritating. You can get them removed, but usually they'll just disappear after pregnancy. So if you're in any doubt or you've got any concerns, just make sure you go and see your dentist to get it checked. So another thing that can happen to your teeth during pregnancy is you may notice your teeth becoming a little bit more loose. Now normally that's a worrying sign. It can be a sign of gum disease or bone loss around your teeth. But again, the hormones can make all your joints and limbs and everything a little bit looser. So do get your teeth checked if you're worried, but don't be too alarmed as long as you're keeping again to a really good oral hygiene regime and you see the dentist regularly to check everything's fine, then everything will just go back to normal once you've had your lovely baby. Lastly, there's a lot of evidence coming out now that links gum disease to premature babies and even a low birth rate baby, and this is because of the types of bacteria that we can have in our mouth when we have gum disease can actually enter our bloodstream and cause problems elsewhere in our body. So this is again something that it's really important that you go and see your dentist and your hygienist. Make sure that you have regular cleanings and screenings, that everything's nice and healthy so that you can give birth to a beautiful, healthy baby. Pregnancy is an exciting and magical time, though of course not without its challenges. So to make sure that you have the best chance of keeping your mouth really healthy and having a beautiful, healthy baby, I always recommend trying to avoid too many sugary snacks and drinks, brushing your teeth twice a day with a fluoride toothpaste, and making sure that you're flossing or using interdental sticks or brushes in between your teeth daily as well. Make sure you see your dentist for your routine checkups and the hygienist too, to keep your gums all really nice and healthy, and just enjoy this time because it doesn't last forever, and these little changes that go on during pregnancy will usually resolve themselves at the end. But if you've got any issues or any concerns, always see a dental professional because we're always here to help and also celebrate. We want to see your new baby when it's born, so don't forget to bring them in too.